You're lying in bed. It's a Tuesday night. Nothing special. You roll over, and for about 4 seconds, your left arm feels heavy. Not numb exactly, not painful, just heavy. Like it belongs to someone else. And then it passes. Completely. You flex your fingers, move your wrist. Everything's fine. So you forget about it. You literally forget about it by the time you brush your teeth the next morning. Now let me ask you something uncomfortable. What if your body has been sending you messages like that, quietly, politely, without any drama, for months, maybe years, and you've been ignoring every single one of them? Not because you're careless, because nobody ever told you what to listen for. Here's the thing that changed the way I practice medicine. Your heart almost never announces itself with chest pain first. That's the Hollywood version. The real version? Your heart whispers. It whispers through your jaw, through your sleep, through the way you climb stairs. Through symptoms so ordinary, so unremarkable, that you'd never in a million years connect them to your cardiovascular system. And in roughly 80% of cases I've seen over 17 years, the very first sign was something the patient had been living with for so long they thought it was just getting older. It's not just getting older, and by the end of this video, you'll know exactly what your body is actually saying. I'm going to walk you through 10 specific signals, the ones I check for in my own practice, the ones published research backs up, the ones most people dismiss until it's a much bigger conversation. And then I'm going to give you a practical, affordable protocol you can start this week. No prescriptions, no expensive tests, just attention and a few changes that cost almost nothing. One thing before we go further. I'm a general practitioner, not a cardiologist. Everything I share here is grounded in clinical evidence and 17 years of seeing patients, but it does not replace a proper evaluation by your own doctor. If anything in this video makes you think, that sounds like me, that's your cue to book an appointment, not to panic, to act. There's a massive difference. Before I start listing symptoms, I need you to understand one concept, just one, and it'll change the way you think about your heart for the rest of your life. That your cardiovascular system is not just a pump and some tubes. I know that's how most of us picture it. A heart that squeezes, arteries that carry blood, veins that bring it back, simple plumbing. But here's what that image misses entirely. That your heart is the central power station for a city of 37 trillion cells. Every single one of those cells needs oxygen, nutrients, and waste removal, constantly, around the clock, without a day off. When the power station starts running at 92% instead of 100, the lights don't go out, they flicker. And the flickering happens in places you'd never think to look. That's what these 10 symptoms are. They're the flickering lights. Symptom number 1, unexplained fatigue that sleep doesn't fix. I'm not talking about being tired after a bad night. I'm talking about the kind of exhaustion where you sleep 7 or 8 hours, wake up, and by 10 in the morning you feel like you've already done a full day. Your legs feel heavy, your motivation is gone. You sit down for a minute and 20 minutes disappear. Here's the physiology. When your heart's output drops, even by 10 or 15%, your body starts rationing blood flow. It prioritizes your brain and vital organs. Your muscles, your extremities, they get what's left over. And what that feels like from the inside is tiredness. Bone-deep, irrational tiredness. Most people blame age, or stress, or poor sleep. They almost never blame their heart. But a study published in the European Heart Journal followed over 4,000 patients and found that persistent, unexplained fatigue was present in more than 70% of people in the 12 months before a cardiac event. 70%. And almost none of them reported it to their doctor. Sound familiar? Stay with me. Symptom number 2, swollen ankles or feet, especially by evening. You take your shoes off at the end of the day and notice your socks have left deep marks around your ankles. Your rings feel tighter too. You think, I was on my feet a lot today, or maybe I had too much salt at lunch. Sometimes that's exactly what it is, but here's the mechanism that matters. Your heart pumps blood forward. When it weakens, fluid starts to back up. Gravity pulls that backed up fluid downward into your ankles, your feet, your lower legs. Doctors call it peripheral edema. I call it your body's low battery warning light. If it happens once after a long flight, fine. If it's happening 3 or 4 times a week, that's not salt. That's your circulatory system telling you it's struggling to keep up. One detail people miss: the swelling is usually symmetrical, both ankles, both feet. If it's only one leg, that's a different conversation, potentially a blood clot, which is its own emergency. But bilateral, recurring, worse-at-night swelling, get your heart checked. Please. Symptom number 3, a pillow problem. This one catches people off guard. You used to sleep flat. One pillow, maybe even no pillow. And gradually, over months, you've started stacking 2 pillows, then 3, and you didn't even think about it consciously. You just couldn't breathe comfortably lying flat anymore. That's called orthopnea, and it happens because when you lie flat, gravity redistributes fluid from your legs back toward your chest and lungs. A healthy heart handles that easily. It just pumps a little harder for a few minutes while you settle. A struggling heart? It can't keep up. Fluid starts to pool in your lung tissue, and you feel that as shortness of breath. So you sit up, you add a pillow, and you adapt, without ever realizing you're adapting to a warning sign. Ask yourself right now, how many pillows are you sleeping on compared to 5 years ago? If the number went up, don't ignore it. Symptom number 4, waking up at night to urinate more than once. Now, I know what you're thinking. That's a prostate thing, or a bladder thing. And yes, sometimes it absolutely is. But I've had patients who'd been treating their prostate for 2 or 3 years, taking medication, adjusting their fluid intake, doing everything right, and the nighttime urination didn't change one bit. Because it was never the prostate. Here's why. When you lie down at night, blood flow to your kidneys increases, because gravity is no longer fighting against venous return from your legs. Your kidneys suddenly get a surge of blood they couldn't process properly during the day, and they respond the only way they know how. They make urine. More of it, faster. So you wake up, not because your bladder is weak, because your heart was struggling during the day, fluid accumulated in your legs, and at night your kidneys are finally catching up. This is backed by published data. A Japanese study of over 1,500 patients found that nocturia, waking up 2 or more times per night to urinate, was independently associated with a 40% higher risk of cardiovascular events. 40%. And that's after adjusting for age, diabetes, and blood pressure. This is real. And here's the part that should make you pause. Frequent nocturia disrupts deep sleep. Disrupted sleep raises cortisol. Elevated cortisol raises blood pressure. Higher blood pressure damages the heart further. It's a loop, a vicious, self-reinforcing loop. And it starts with a symptom most people laugh about. You know what? Let me pause here and tell you something encouraging, because I don't want you sitting there feeling anxious. Every single one of these symptoms is a signal, not a sentence. Your body isn't breaking down, it's communicating. And the fact that you're watching this, paying attention, thinking about it, that already puts you ahead of 90% of people who just shrug it off. So let's keep going. Because the earlier you recognize these signals, the more options you have. And some of those options are absurdly simple. Let me tell you about a man I'll call David, 61 years old, retired engineer. Lean build, never smoked, walked his dog every morning without fail. By every visible measure, this was a healthy man. He came to see me because his wife was worried, not him. She noticed he'd started pausing halfway up the stairs. Not stopping, pausing, just for a second, catching his breath almost imperceptibly and then continuing as if nothing happened. David told me, and I remember this clearly, he said, "Doc, I'm 61. I'm not going to bound upstairs like I'm 30. That's just life." I ran some basic bloods. Everything looked fine. Cholesterol was borderline but not alarming. Blood pressure, slightly elevated, 140/88. I could have sent him home with a lifestyle leaflet, and honestly, 5 years earlier in my career, I might have. But something made me push further. I ordered an NT-Pro BNP test. It's a blood marker that goes up when the heart is under strain. David's result came back at 420 picograms per milliliter. Normal for his age is under 125. His was over 3 times the upper limit. We sent him for an echocardiogram. His ejection fraction, that's the percentage of blood your heart pumps out with each beat, was 38%. Normal is 55 to 70. David's heart was working at roughly 2/3 capacity, and he had no idea. No chest pain, no dramatic symptoms, just a slight pause on the stairs that his wife noticed and he dismissed. Here's what gets me. David had been waking up twice a night to urinate for over 2 years. He'd been to a urologist. He'd had his prostate checked. Everything normal. He'd started elevating his legs in the evening because his ankles felt puffy. He'd added a second pillow 6 months ago because sleeping flat just wasn't comfortable anymore. 3 symptoms, all 3 pointing to the same thing. And not a single one of them in isolation seemed alarming enough to investigate his heart. David's on medication now. He walks further than he has in years. His wife says the stair pausing is gone. But he told me something at his last follow-up that I think about often. He said, "I just wish someone had told me what to listen for. I would have come in 2 years earlier." That's why this video exists. Symptom number 5, jaw pain or toothache that your dentist can't explain. This is one of the most under-recognized cardiac symptoms in medicine, especially in women. You get an ache in your lower jaw. Sometimes it radiates to your ear. You go to the dentist. They x-ray everything, find nothing wrong, and send you home with a night guard for grinding. And the ache comes back, usually during physical exertion or stress. That jaw pain is referred pain from the vagus nerve, one of the longest nerves in your body, running from your brainstem down through your chest. When your heart muscle is starved of oxygen, even mildly, the distress signals can travel along shared nerve pathways and surface as jaw pain, earache, or even a sore throat. A study from the American Heart Association found that isolated jaw pain was the only presenting symptom in roughly 6% of heart attack patients. No chest tightness, no arm numbness, just a jaw that hurt. Symptom. Number 6. Sudden cold sweats with no obvious cause. You're sitting at a table, you're not anxious, you're not hot, and suddenly your forehead is damp, your palms are clammy, and you feel a wave of something you can't quite name. Not dizziness, not nausea, just wrong. Cold sweats are your sympathetic nervous system going into alert mode. It's the body's emergency broadcast system. When cardiac output drops suddenly, even for a few seconds, your body releases adrenaline and noradrenaline to try to compensate. One of the side effects? Sweat. Not the healthy exercise kind, the cold, sticky, something's not right kind. If this happens to you during rest, not during exercise, not during a hot flush, but while you're calmly sitting or lying down, that is worth a phone call to your doctor. Full stop. Symptom number 7. Shortness of breath doing things that used to be easy. You could carry groceries from the car to the kitchen without a second thought. Now you set the bags down at the door and take a breath before continuing. You could talk while walking. Now you choose, talk or walk, but not both at the same tempo. This one is tricky because it happens so gradually. Your body adapts. You slow down without noticing. You take the lift instead of the stairs and don't question why. The clinical term is exertional dyspnea, and it's one of the earliest functional markers of reduced cardiac output. Your heart simply can't deliver enough oxygenated blood to your muscles and your respiratory system simultaneously under load. So you feel winded, and you blame it on fitness, or weight, or age. I'm going to say something that might sound strong, but I mean it. If your exercise tolerance has noticeably declined over 6 months and you haven't gained significant weight or developed a respiratory condition, assume it's cardiac until proven otherwise. Get it checked. Symptom number 8. Persistent dry cough, especially when lying down. Not a cold, not allergies. A dry, nagging cough that seems to come from nowhere, gets worse at night, and doesn't respond to cough medicine. You might have been given an inhaler. It didn't help. This can be a sign of fluid beginning to accumulate around the base of your lungs. Early-stage pulmonary congestion caused by the left side of the heart not pumping efficiently. The fluid irritates the airways. The body coughs to try to clear them. But there's nothing to clear in the traditional sense. It's not mucus, it's plasma leaking into tissue where it doesn't belong. Think of it as your lungs trying to wring out a damp towel. If you've had a dry cough for more than 3 weeks, your chest x-ray is clear, and nobody's thought to check your heart. Bring it up. You have every right to ask. Now, before I continue to symptoms 9 and 10, I want to hear from you. Drop your age in the comments. Just a number. I'm not being nosy. I genuinely track this because it changes how I prioritize future topics. If most of you watching are between 55 and 65, I'm going to focus on very different risks than if you're over 70. Your number actually shapes the content. So please, just a number. That's it. Symptom number 9. Dizziness or lightheadedness when you stand up. You've been sitting for a while. You stand up. The room tilts. Everything goes gray at the edges for a second or two, and then it comes back. You grab the doorframe, wait, and carry on. The medical term is orthostatic hypotension, a drop in blood pressure when you change position. And while it can happen for many reasons, including dehydration and medication side effects, it can also be an early sign that your heart is struggling to adjust its output quickly enough when your body's demands suddenly change. In a healthy system, when you stand, your heart rate bumps up slightly and your blood vessels constrict to maintain pressure. If the heart can't respond fast enough, your brain, which sits at the top of the system and gets hit first, briefly loses adequate blood flow, hence the dizziness. A meta-analysis published in the Journal of the American College of Cardiology, covering over 65,000 participants, found that orthostatic hypotension was associated with a significantly elevated risk of heart failure, coronary events, and all-cause mortality. That's not a niche finding. That's 65,000 people. If this happens to you regularly, more than a couple of times a week, it's worth a proper blood pressure assessment, including lying to standing measurements. Most routine checks only measure you seated. Ask for the postural reading. You have to ask. Symptom number 10. A sense of anxiety or doom with no trigger. This is the one that gets dismissed fastest. And I think it might be the most important. You're not an anxious person. You've never had panic attacks. But lately you've had these moments, brief, passing, unexplained, where something feels deeply wrong. Not emotionally, physically. A tightness in your chest you can't quite describe. A feeling that something bad is about to happen, except nothing is happening. Your GP might call it anxiety. They might offer you a low-dose SSRI. And for some people, that is genuinely the right answer. But here's what I've learned in 17 years. When a previously calm, stable person in their late 50s or 60s suddenly develops a sense of impending doom, especially if it comes with any of the other symptoms on this list, that feeling might be your autonomic nervous system detecting a cardiac problem your conscious mind hasn't caught up with yet. Your body knows before you do. I've had 3 patients over the years who came in saying, essentially, I just feel like something's wrong. No specific complaint, no clear symptom, just a feeling. All 3 had significant cardiac findings on follow-up. Listen to that feeling. It might be the most honest signal your body sends. And here's the good news, and I really do mean this. None of these symptoms by themselves are a guarantee of heart disease, not a single one. But when 2 or 3 of them overlap, when they've been present for weeks or months, that pattern is worth investigating. And investigating early is not the same as panicking. It's the opposite of panicking. It's being the kind of person who takes their body seriously enough to listen before it has to scream. Now let's talk about what you can actually do. Starting today, no prescriptions, no expensive gadgets, no supplements with 17 unpronounceable ingredients. Just practical, evidence-backed habits that cost almost nothing. Method 1. The morning check-in. Why it works. Your resting heart rate first thing in the morning, before you get out of bed, before coffee, before you even sit up. is the most reliable daily snapshot of your cardiovascular baseline. A consistently elevated resting heart rate above 80 beats per minute is independently associated with increased cardiac risk, and tracking trends matters more than any single number. Here's what to do. Keep a cheap digital watch or your phone on your bedside table. Every morning, before your feet touch the floor, press 2 fingers against the inside of your wrist, just below the base of your thumb. Count the beats for 30 seconds. Multiply by 2. Write it down. A notebook, your phone's notes app, a scrap of paper. Doesn't matter. Do this for 14 consecutive days. If your average is consistently above 75, and especially if it's trending upward, mention it to your doctor at your next visit. Cost: nothing. Time: 45 seconds a day. Method 2. The leg elevation flush. Why it works. Elevating your legs above heart level for 15 to 20 minutes activates venous return. It helps blood that's been pooling in your lower extremities move back toward your heart and kidneys. This reduces the fluid load your heart has to manage overnight, which can directly improve sleep quality and reduce nocturia. Here's what to do. Every evening, about 90 minutes before bed, lie on your back on the floor or your bed. Put your legs up against the wall, or prop them on 2 or 3 stacked pillows. The goal is to get your ankles above the level of your chest. Stay there for 15 minutes. Just breathe. No phone scrolling. Let gravity work for you instead of against you. Important: if you have severe varicose veins or a history of deep vein thrombosis, talk to your doctor before doing this regularly. For most people, it's perfectly safe and remarkably effective. Cost: 2 pillows you already own. Time: 15 minutes. Method 3. The potassium protocol. Why it works. Potassium is one of the most important electrolytes for heart rhythm regulation and blood pressure control. Most adults over 50 get roughly half the recommended daily intake. You don't need a supplement. You need to eat differently at breakfast. Here's the protocol. 3 mornings per week. Start with 1 medium banana. That's about 420 milligrams of potassium, and a small handful of unsalted almonds, roughly 30 grams. On the other 4 mornings, add half an avocado to whatever you're already eating. 1 medium avocado half contains approximately 485 milligrams of potassium and healthy monounsaturated fats that support arterial flexibility. Week 1. Add the banana on Monday, Wednesday, and Friday. Avocado on the other days. Week 2. Keep the pattern. Your body takes about 10 to 14 days to adjust potassium utilization. Week 3 onward. Maintain this as a permanent habit. Reassess with a blood test at your next annual checkup. Caution: if you have chronic kidney disease or you're on potassium-sparing diuretics like spironolactone, do not increase potassium without talking to your doctor first. This is critical. For everyone else, this is safe, cheap, and backed by large-scale data showing a clear association between adequate potassium intake and reduced stroke and cardiac event risk. Cost: a banana costs pennies. An avocado costs a little more. This is not an expensive change. Method 4. The walking conversation test. Why it works. This is the simplest, most practical way to monitor your exercise tolerance over time. And exercise tolerance is one of the strongest predictors of cardiovascular health we have. Here's what to do. Once a week, go for a walk at your normal pace with someone, a partner, a friend, a neighbor. Talk to them while you walk. The test is this: can you maintain a normal conversation without needing to pause for breath? Not a brisk hike, not a power walk, your natural, everyday, getting to the shops pace. If you can talk comfortably, your cardiovascular output is managing the combined demand. If you find yourself cutting sentences short, pausing mid-thought, or choosing between talking and walking, your exercise tolerance may be declining, and that's worth monitoring. Do this every week. Same route if possible, same pace. Notice whether the conversation is getting easier, staying the same, or getting harder over 4 to 6 weeks. If it's getting harder and nothing else has changed, that's a data point your doctor needs to hear. Cost: absolutely nothing. Time: however long you like walking. Method 5. The salt awareness window. Why it works. Excess sodium causes your body to retain fluid. That fluid increases blood volume. Increased blood volume makes your heart work harder. For most people over 50, the daily sodium target should be below 2,300 milligrams. That's roughly 1 teaspoon of table salt. Most people consume more than 3,400 milligrams daily without realizing it, because most sodium comes from processed and restaurant food, not the salt shaker. Here's the practical step. For 2 weeks, just 2, read the sodium content on everything you eat that has a label. Everything. Bread, canned soup, deli meat, sauces, cereals, frozen meals. Write down the total for each day. You will be shocked. I guarantee it. I've had patients who considered themselves healthy eaters discover they were consuming over 4,000 milligrams of sodium a day. You don't have to become obsessive about it. The point is awareness. Once you know where the sodium is coming from, you can make 2 or 3 simple swaps. Reduced sodium bread, rinsing canned beans, making your own salad dressing instead of bottled, and bring your intake down by 30 to 40% almost immediately. Cost? Nothing. Just attention. Method 6. The evening breathing reset. Why it works. Slow, controlled diaphragmatic breathing activates your parasympathetic nervous system, the branch that lowers heart rate, reduces blood pressure, and counteracts the cortisol spikes from chronic stress. A study from the Journal of Hypertension showed that 6 weeks of daily slow breathing practice, just 5 minutes a day, reduced systolic blood pressure by an average of 8.6 millimeters of mercury. That's comparable to a low-dose blood pressure medication. From breathing. Here's the protocol. Sit in a chair or lie in bed. Breathe in through your nose for 4 seconds. Hold for 4 seconds. Breathe out through your mouth for 6 seconds. That's 1 cycle. Do 6 to 8 cycles. The whole thing takes under 5 minutes. Do this every evening, ideally within 30 minutes of your bedtime. It transitions your nervous system from sympathetic dominance, the on mode, into parasympathetic recovery. Think of it as manually flipping the switch from daytime to nighttime mode. Week 1, 4 cycles per session, just to build the habit. Week 2, increase to 6 cycles. Week 3 onward, 6 to 8 cycles, every night. Cost, 0. Contraindications, none. Side effects, better sleep. All right, here's your cheat sheet. Screenshot this if you want. This is the part you come back to. Check your resting heart rate every morning before getting out of bed. Count for 30 seconds, multiply by 2, write it down. Do this for 14 days straight. Elevate your legs above chest height for 15 minutes every evening, about 90 minutes before sleep. Add a banana 3 mornings a week and half an avocado on the other 4. Simple potassium loading that supports heart rhythm and blood pressure. Walk and talk once a week, same route, same pace. Track whether holding a conversation is getting harder over 4 to 6 weeks. Read sodium labels for 2 straight weeks. Just observe, then make 2 or 3 swaps where the numbers surprise you. Breathe. 4 seconds in, 4-second hold, 6 seconds out. 6 to 8 rounds every evening before bed. 5 minutes. That's it. Now. Red flags. The moments where you stop managing this at home and you pick up the phone. Call your doctor or go to A&E if it's severe. If you experience any of the following. Chest pressure or tightness that lasts more than a few minutes, especially during rest. Sudden, severe shortness of breath that isn't explained by exertion. Fainting or near fainting with no obvious cause. Sudden swelling in both legs that appears overnight. Heart palpitations that are new, last more than a few minutes, or come with dizziness or breathlessness. These are not wait and see situations. These are act now situations. Everything else I've walked you through in this video supports your body's own function. It monitors. It optimizes. It gives your cardiovascular system the best possible environment to do its job. But it does not replace clinical evaluation when something genuinely needs to be examined. If in doubt, get checked. That is always, always the right call. I want to leave you with this thought. Your heart has beaten roughly 2.5 billion times by the time you reach 60. It has never taken a day off. It has never asked for a holiday. It doesn't complain. It signals. Quietly. Politely. In ways you've probably been dismissing for longer than you'd like to admit. The 10 symptoms I've just walked you through are not rare. They're common, incredibly common, and they're ignored every single day. Not because people are foolish, but because nobody sits them down and says, this is what these signs actually mean. Nobody in a white coat is going to spend 25 minutes with you doing this. Not because they don't care, because the system doesn't allow it. Your doctor gets 7 to 10 minutes per appointment. They're buried in paperwork and targets and protocols that reward intervention, not prevention. That's not a conspiracy. It's just how the economics work. The system gets paid when you're sick, not when you stay well. And that structural reality is exactly why this channel exists. If any of this made you think, even once, that sounds like me, then please share this video with one person you care about. Not a stranger, someone specific. The one who dismisses their symptoms. The one who says, I'm fine. The one who won't go to the doctor unless you physically drag them. Send them this link. It might be the nudge they needed. Subscribe if you haven't already. Hit the bell so you don't miss the next one. And I'll see you in the next video, where we're going to talk about the single cheapest blood test that tells you more about your heart than almost anything else, and why it's almost never ordered unless you ask for it by name. Take care of your heart. It's been taking care of you your entire life.